One, go.
Good morning. My name is Farrell David, and I'm one of the educators at Oshner UHC. I'm going to talk to you about the Broselow Cart today. The Broselow Cart, or our pediatric emergency crash cart, is available on all those units at UHC where we entertain pediatric guests. Unfortunately, we do not house inpatient pediatric patients, so we still do have those that come in for surgeries and such, so we do have carts available to respond in times of need. The cart itself has multicolored drawers on the front that correlate to the Broselow tape that you'll find in the top, on the top of your cart in a Ziploc bag with other items of use. So when you pull your patients, when you pull the Broselow tape out of the package, you want to open it up. Your patient's going to be lying on a firm surface, and you're going to open up the tab so that you place the red tab on one end at the head of the patient and extend the tape down until you can place his heel on a certain color. This is going to help measure a patient's ideal body weight based on his length. And so whichever color the heel falls on, not only does it give you information on doses of medications and size of the tools that you would be able to use for him, it also correlates to a drawer on this cart. All of these tabs are locking tabs, and if my heel landed on the blue for this patient, I would open up this blue drawer, and there is equipment in here that would be size appropriate for that patient. Each drawer has the same type, each color drawer has the same equipment in there, only sized differently depending on the patient's weight. Okay. Other things that you're going to find on the top of the cart in this package are going to be quick combo defibrillator pads, both adult and pediatric sized pads. You're going to have inventory sheets on materials and medicines with dates of the earliest expiration on the device, so you can have it replaced as soon as you need to. Remember, anything that expires within 31 days or 30 days needs to be swapped out as soon as possible. You're going to find the cardiac board in a little slot on the back of the cart. Make sure that your patient is on a firm surface. If not, you want to slide the cardiac board under the patient's back to give him a firm surface for chest compressions if you need it. The medicine drawer is on top. The top drawer is going to be locked with a red locking device. That's where your medicines are going to be. The medicine drawer comes in encased in a plastic bag. You're going to have an inventory in here, an inventory sheet in here as well as a yellow locking tab. The yellow locking tab is for you to replace on this. Once we're finished with the code, you relock this drawer up to prevent med diversion. At the bottom, you have a utility drawer for miscellaneous equipment, which includes everything from fluids and suction canisters, Buretrols, IO device with accessories, forceps, tubing, IV tubing as well, nasal cannula, face mask, extra equipment. It'll all be down here for you. Once we're finished with also on the side, I can't forget the side, you've got bamboo bags and 3 different sizes to fit your different size patients. Once a code is done and we're finished with this cart, care and maintenance, you need to make sure that you pick up and discard trash in appropriate receptacles. Boxes of meds, casings, empty med cases are all going to go in the proper receptacles. Make sure you discard your sharps in a sharps disposer. And then we're ready to go ahead and have it swapped out. So one thing that we need to do is we need to contact EVS, excuse me, to come and sanitize the whole cart for us. Once the cart is sanitized, we're going to take a copy of the code sheet, place it on top of the cart with the patient label on here. And then we're gonna contact materials management to come and restock or replace things in the cart. They're gonna take it, they'll come and restock it and bring it back to us. The pharmacy is gonna take care of the medications, but materials management will bring that to the pharmacy. If materials management is not here that day, whether it's after hours or the weekend, your house supervisor is gonna help you with restocking or replacing your cart, okay? Cart requirements on a daily basis, we check our crash carts on a daily basis. That is a responsibility of the charge nurse, who can delegate that to someone else on the unit. We want to make sure that we fill out all the slots in the crash cart check log. Anytime you have a day that is not recorded, if you were not here that day, you need to mark that unit as closed or holiday or something. Make sure all of the daily slots are filled out. Thank you very much.